Health Beat with Dr. Vanita Zahn.
In the wake of George Floyd's death, witnessed nationwide and eventually worldwide, protesters took to the streets to demand justice and much more. The racial inequality that could lead to his death at the hands of a police officer and so many other cases like that have brought us to a day of reckoning. That racial disparities in this country have to be addressed, and they're not just in policing, but in housing, employment, and health care. To that end, my guest is Dr. Julia Hastings. She's an assistant professor in both the School of Public Health and the School of Social Welfare at Albany. Hi, Dr. Hastings. Thanks so much for taking time to be with us.
Oh, my pleasure. My pleasure.
As we are looking at our society and racial inequality and racism, we have to talk about healthcare. And I know that in some circles, all you have to do is say Tuskegee, and a whole population of people of color go, I'm done. I don't want to even see a physician because of the mistrust that has lingered for generations. How do we begin to rebuild the trust so that healthcare can be delivered appropriately?
I think we're in very interesting and opportunistic times right now, in that we can now face, I think, what people can have avoided before is the word racism. And racism in healthcare is not the avoidance of providing care, but it's really thinking about being the racist, being about the actual person providing the care. It's about doing, about perhaps not prescribing the full complement of treatments because there are prejudgments about what patients can and cannot participate in. And it really is thinking about, what does inaction mean? Is that when someone says, oh, I see something, and then they choose not to act on it, that is also kind of, I would label it as a racist act if I were to kind of steal that little phrase from Dr. Kamala Jones. And in order for us, I think, to move forward, we all as a community of both providers as well as patients, or even as clients in my field, would really have to think about how do we internalize and understand our role in racism. And each one of us plays a very different role in it, and sometimes we play multiple roles. And I think we are at a time in society where we are ripe for change, and we are ripe for making differences. And for example, it's like we can't rely on kind of the verbiage that is going around right now. We are really at the point where we can really create new policy, and policy that matters to people, that will change their life outcomes, their health.
So how do we start? Does it start in the university with what you're teaching the next generation? Or does that have to go hand in hand with all of us making a change? I was speaking with the new diversity director over at Albany Medical Center, and she says, institutions are racist, and medical, the medicine is an institution. So, she's looking to bring in the community, and they're looking to better when they were looking at medical school students, and to diversify more. I think 17% of their population is African American. They know they need to change that. So I guess, what's the mix that you see, Dr. Hastings, that we should be at least striving for?
As I mentioned earlier, we not only have to begin working with the new professionals that will be graduating and performing professional service, but we also need to work with those of us who are already here doing it and participating in it, because I think we've become complacent in that we kind of recognize things. It's like, oh, but we kind of also walk away from it and saying, oh, this doesn't affect me. But it really does. We are all affected as a community in a variety of ways. And you asked me about, do we start with our students? And I said, yes. I very much so believe that students are, they're lighting our path for helping kind of those of us who are seasoned in our profession to take risks and to move about our society, about our community, involve ourselves in our services very differently. That we really do need to understand and work with the medical profession about what are our rights, what do we expect from a visit, and how do we understand our health care? And I think everyone has a role in that.
What should every medical practice, I don't care, who they're treating, what should every medical practice be doing now to begin the conversation, to begin making the change, to begin providing better care?
I think beyond the question I always am asked when at least in my visits, is how are you? I do think the question needs to be changed. It's how may I help you? And that is an invitation to understanding that the person is there to help you achieve better health. And that puts us on a very different plane when we start our medical visits, is if we cannot see the person who's sitting in front of us as being the helper or the person that helped to move us from one state of health to another, then I do see we've kind of failed the system, because then it's from the professional's opinion on down and not from kind of the person or the patient. I was like, oh yes, I believe that this person can help me get better.
And they have to look at you too.
Yes, much longer than 2 minutes.
Does telemedicine pose particular challenges, or does it open the door to improved care, or at least an improved conversation?
I believe telemedicine is our next blossoming phase. I mean, New York is already ahead of the game. We've had telemedicine for a few years now, several years. And what it will offer us is an opportunity to reach segments of the population that have fear of meeting, whether it's with physicians or with nurse practitioners, social workers, other professionals, in that although it does break down boundaries, I think, in saying and starting the health conversation, it also will raise issues of those who are challenged with technology, in that they may or may not have the equipment or the understanding of how to use it. But telemedicine truly is a way to breach the divide that we have about distance, about kind of barriers, is that you can still see a person and it actually can increase treatment. And that's where I think right now, where we're in society, we need to think of ways where people can receive the help that they need. And telemedicine is one of those.
Dr. Hastings, I said to you before we started the official part of the conversation, we're going to go way more than 5 minutes. And we have, and I know that this is a conversation that we can continue to build on. So I hope you'll be able to come back and we can do just that in the weeks ahead.
Absolutely. Thank you so much.
Dr. Julia Hastings, thanks so very much. Be well.
And as always, thank you for taking the time to check out HealthBeat. New programs post every Monday and Thursday. And if there's a topic you'd like addressed, just drop me a note at bzon@wnyt.com. We'll see you next time.